can you give us an example of somebody who's gone through your program and how they've integrated it in their own lives, how it's changed their performance, and how they've shared that with their own patients?
In 2010, I did a study in the intensive care unit, in the surgical intensive care unit it was a randomized controlled trial with anybody who worked in the surgical intensive care unit. And there was one nurse who was part of the mindfulness program, came in the first day, was so stressed. And she's like, turn on the lights. And I don't like the feeling that's been created in this room. And we were all taken aback. But I explained to her why we dim the lights, how it aids in relaxation. Fast forward, at the end of the session that day, 2 other nurses approached me and they said, we need to drop out of this. We can't do this 8-week program. And I said, oh no, I need you. I need you for the numbers. Please don't drop out. I said, well, why would you drop out after today? You didn't like it? And they said, no, she's the source of our stress. And I thought, oh no, wow, this program is really needed. So I convinced them not to drop. But fast forward to the nurse that was so stressed out that caused other people wanting to drop. She became the biggest proponent for mindfulness ever. And the other nurses and the other employees that were part of the study came to understand the source of her stress. And in the end, we ended up using her like on promotional videos and all this other stuff for patients to use mindfulness, for other healthcare professionals. So she is an example where I don't think she ever would have signed up for a mindfulness-based intervention if it had not been part of her workday. And she ended up then trying to use it with her patients and to convince other people, other employees of the health system to use it.